following presentation will be a demonstration of how to navigate Health Passport. We will walk through each module of Health Passport, explain the module's purpose, and appropriate steps to find the information you may be looking for from within the application. What is Health Passport? Developed in coordination with DFPS and HHSC, Superior's award-winning Health Passport is a patient-centered, internet-based health record. It makes a foster child's information available to authorized providers and medical stakeholders, such as medical centers and caseworkers. Health Passport contains information on patient demographics, claimed visits, allergies, lab test results, immunizations, and field medications. There are also electronic Texas Health Steps, dental, and behavioral health forms available within Health Passport. Health Passport was designed to improve care coordination and increase communication by connecting authorized providers, state agencies, and medical centers with health information from various facilities and clinicians. Once logged into Health Passport, the very first thing every user will see is the user agreement and disclaimer. Review the agreement, scroll to the bottom, and click I have read and agree to these terms to continue. The user agreement displays to ensure every user understands their responsibilities when accessing the sensitive information contained in the application related to children in foster care. To search for a member, enter the member's first and last name, followed by the Medicaid ID, SSN, or DFPS ID in their respective fields. Only the first two letters of the member's first name and last name are required to search. Search results will display below the search bar. Health Passport displays information for those members who are currently eligible for foster care. Once the search results are visible, click the member's name to open the health record. Information for former foster care members can be obtained by contacting us here at Superior Health Plan. I will share our contact information at the end of this presentation. Every member's health record will contain 10 modules. These modules encompass a range of information regarding a member's health and services performed to care for the member. A module is a section of information found within the member's health record and will be a term used throughout this presentation. Each module is accessible by using the navigation buttons to the left. The face sheet is the first module and is the home page of a member's health record. It provides an easy-to-read summary of the member's demographics with a key focus on information that is critical for providers at the point of care. The face sheet includes a list of care gaps, Texas Health Steps last visit date, last dental visit date, most common diagnosis and procedures, active allergies, and active medications. Top 5 diagnosis and procedures are those that are most prevalent in the member's record. Active medications are those that a medical professional prescribed in the past 90 days. The Contacts module conveniently lists the foster child's PCP, medical centers, caregiver, caseworker, and service coordinator in one place. Keep in mind that a listed caregiver is not always a medical center. A contact must be listed as a medical center to make medical decisions and therefore may appear twice on this list, once as a caregiver and once as a medical center. Refer to the list to ensure the appropriate individual is contacted concerning member care. The Allergies module contains all allergies for a member entered by providers. Once an allergy is charted, it is instantly checked for interactions against the medication history. Interactions with medications are indicated by the red M symbol to the left of the allergy substance. The allergy substance can be clicked on to view more information, including first occurrence date, provider comments, and allergy history. An allergy with a strike-through indicates either a resolved or canceled status. Resolved allergies are those the member no longer experiences. Canceled allergies are those that may have been mistakenly entered into the health record. Existing allergies can be modified by clicking on the substance and selecting Modify. Make changes where necessary and click Update to save the changes. Alternatively, you can click the Cancel button to go back to the Allergies module. Allergies can be added to the member's health record using the Add Allergy tab. Type the name of the allergen in the search box and click Go. The Add Free Text Allergen box can be used to enter an allergen that isn't found using the allergen search. Click the allergen name that best fits the substance causing the member's allergic reaction. Complete the remaining detail fields and click Add to enter the allergy into the foster child's health record. Alternatively, you can click Cancel to go back to the Allergies module. The Assessments module contains Texas Health Steps, Dental, Child Adolescent Needs and Strengths, and Behavioral Health forms. The assessment name and submit date are viewable and categorized by form type. The Expand All and Collapse All buttons reveal and hide all forms for all categories. Specific categories of forms can be expanded and collapsed by clicking on each category header. This may be an ideal option for those members with a longer history of forms. The details and contents of a form can be viewed by clicking the specific assessment name. A new window will open that contains the respective assessment's details. Texas Health Steps, Behavioral Health, and Dental forms can be entered online using the Submit Forms tab. Use the same Expand and Collapse buttons to find the correct form template. Descriptions of each form template are provided to the right of the form title. Select a form template by clicking the form title. Enter the necessary information and click Submit when the form is complete. Forms will appear in the member's health record 24 hours after they have been submitted online. Please note that a form in progress cannot be saved. Forms must be completed from start to finish in one sitting to avoid losing any information entered. Forms may also be faxed or mailed. Printable versions of all forms can be accessed from the PDF button. A fax number and mailing address can be found on the Superior Health Plan website. The Growth Chart module is designed for providers to record weight, height, length, and head circumference to track the growth of infants and children. BMI is automatically calculated based on measurements entered. A star next to a value indicates there's a comment associated with the entry. Comments and other details can be viewed by clicking on the date and time of a given growth chart entry. Use the Add Growth Chart tab to enter new growth chart measurements. Enter each value and click Add. Alternatively, you can click Cancel to go back to the Growth Chart module. Any new growth chart entry will appear at the top of the growth chart history. Growth chart entries can be canceled in the event there is an error or duplicate entry. Select the entry to cancel from the growth chart by checking the box in the Select to Cancel column. Choose the reason for removing the respective entry and click Cancel. The Immunizations module provides a list of immunizations the foster child has received that have been reported to MTRAC, the Texas Immunization Registry. Immunizations can be sorted by vaccine or date administered by clicking on the column titles to change the view. The Schedule tab houses links to the child, adolescent, adult, and catch-up immunization schedules provided by the Centers for Disease Control and Prevention, or CDC. The Care Gaps tab lists any gaps in care the member has, including missing immunizations. The Labs module contains lab results for the member and includes information about the item, value, ordering physician, source, and category of each lab listed. Labs can be filtered by category using the Filter Category dropdown. Labs can be sorted by date by clicking the Date column. A star next to a value indicates there's a comment associated with that specific lab. Details of each lab can be viewed by clicking on the date and time of a given lab. Additional pages of labs can be viewed by clicking Next, Last, or the respective page number at the bottom of the module. The medication history module provides a summary of medication prescriptions that have been filled and picked up. Information includes fill date, medication, quantity, day supply, prescriber, and pharmacy. Medication to medication and allergy to medication interactions are indicated to the left with varying symbols. A legend to interpret these symbols is provided just above the medication history. Details about each interaction can be viewed by clicking on the medication interaction symbol to the left of a given medication. Click on prescriber and pharmacy names to view contact information. A medication's prescription history and reference documents can be obtained by clicking on the medication name. Additional pages of medication history can be viewed by clicking Next, Last, or the respective page number at the bottom of the module. Patient history displays visit details collected from claims data for all services rendered, whether paid or denied. Information for each visit can be viewed by clicking on the date in the first column to the left. Patient history can be sorted by date, visit type, billing entity, and source by clicking on the respective column header at the top. The Diagnosis tab lists patient history by diagnosis. Diagnoses can be sorted by clicking on the date, diagnosis, DX code, billing entity, and source column headers at the top. View diagnosis descriptions by clicking on the date. The Procedure tab lists patient history by procedure. This information can be sorted by date, procedure, CPT code, billing entity, and source by clicking the respective column header at the top. View procedure descriptions by clicking the date. Note that providers have 95 days to bill, and the health plan has 30 days to process before claims will load to Health Passport. Please keep this in mind when looking over visits in the application. The last module of Health Passport is the Appointments module. This module displays appointment entries from providers. The module includes date and time of the appointment, appointment duration, and a description of the reason for the appointment. Additional details about each appointment can be viewed by clicking on the date and time. There are a few other tools to demonstrate that are available in Health Passport. The assessments, growth chart, immunizations, labs, medication history, patient history, and appointments modules each offer a date filter feature. Today we'll be demonstrating the filter feature from the immunizations module. Select a date range from the drop-down menu or enter a from date and to date to filter how much information is displayed. Health Passport displays 10 years of member history and makes this information available to search online. Health Passport also offers the feature to print a member's complete health record by clicking Print All in the upper right-hand corner. Select a date range and click Go. The record will display in PDF form and be made available to print. To print a single module, click on the Print button below the Print All link. The record will display in PDF form and be made available to print. This completes the Health Passport demonstration. For more information, please visit our website at www.superiorhealthplan.com. For support, email texaspassportadmin@centene.com or call 866-714-7996.